Welcome to the Health Coach OT. I'm Dr. Jaclyn Schwartz, occupational therapist, scientist, and board-certified health coach. If you're a therapist ready to expand beyond traditional interventions, you're in the right place. From nutrition and stress to lifestyle factors that truly drive lasting client outcomes. Today, we're diving into 3 distinct career paths in health coaching for occupational therapy practitioners. Let's get started. Whether you're considering an alternative career path or seeking to improve your clinical skills, health coaching offers incredible opportunities for occupational therapy practitioners. Our unique training in activity analysis, behavior change, and client-centered care make us naturally suited for coaching roles. Health coaches work across a variety of settings. Today, I'm going to break down 3 distinct career paths in health coaching, each with different benefits, challenges, and income potentials that also leverage your OT background. So option 1 is working as a health coach for an established company. The first option, and often the most accessible for occupational therapy practitioners transitioning into health coaching, is to work as an employee or a contractor for an established company. This path offers structure and immediate income. So what does it look like? So typically, it's a job where you're working remotely to provide health coaching services to clients through a platform or program developed by your employer. These positions are commonly offered by companies like insurance companies, large corporations with employee wellness programs, or health tech startups developing a coaching app. Often, these services are designed to be provided to an employer or insurance company covering people with a variety of chronic diseases. Or sometimes there are positions focused on a specific health condition like diabetes, fertility issues, or ADHD. So let's talk about the pros and cons of this setting. The pay is typically less than a traditional occupational therapy salary, but here's what makes it attractive. You can create your own schedule and often work completely remotely. For OTs who are dealing with burnout from traditional settings or those wanting more geographic flexibility, this can be incredibly appealing. While the flexibility is wonderful, you are working within someone else's system and protocols, so you'll have less autonomy over your coaching approach and client selection. But this can actually be beneficial when you're starting out because you get started quickly without having to build the business infrastructure. The second option is building your own independent health coaching practice. The second path is entrepreneurial, where you create your own health coaching business. So this requires more upfront work, but offers broader income potential and complete autonomy over your practice. So what this involves is you'll need to develop your own business model, create marketing strategies, and find your own clients. Many successful OT health coaches focus on a niche that aligns with their OT experience, like working with parents of kids with autism, adults with chronic conditions, or specific populations they've served in their OT practice. In future episodes, I'll be interviewing occupational therapists who work as coaches so you can learn more about their business and their business model. So let's talk about the pros and cons of this setting. So speaking of business model, this feels similar to opening a cash-based OT practice, but with an important advantage. When you're wearing a coach hat and working within the coaching scope of practice, you could work across state lines and you can have sessions in person or online. So this dramatically expands your potential client base, but success in this path does require strong marketing skills, often through social media platforms like Instagram or LinkedIn, or even local networking within your city. So you'll need to become comfortable with content creation, building an audience, and selling your services. While it does take time to build, successful independent coaches can earn significantly more than employee coaches or even traditional OT salaries. However, income could be variable, especially in the beginning. Finally, the third path might be the most immediately practical for many listening, integrating coaching skills into your existing OT practice. This approach allows you to enhance your current work while potentially creating new opportunities. So how this works is you begin by incorporating evidence-based coaching techniques into your current practice, and this might mean using more motivational interviewing, implementing health behavior change strategies, or taking a coaching approach to goal setting. And so you will likely see better outcomes with your current clients, and coaching skills enhance everything we already do as occupational therapy practitioners. They just give us more effective tools for supporting behavior change and client engagement. As you develop these skills, you can approach your current employer or other OT employers about creating a position that leverages your coaching skills. While most insurance does not cover health coaching at the moment, you would likely still be working and billing as an occupational therapy practitioner. You would just be using your enhanced skill set to get better results. I'm seeing more OTs do this by partnering with primary care physicians or primary care clinics to better address chronic disease management. And I've seen OTs who are able to create hybrid roles that combine traditional OT services with coaching approaches. These positions recognize that addressing lifestyle factors like nutrition, physical activity, and stress management is crucial for managing chronic conditions. And when chronic conditions are adequately managed, that helps people do the things that they need and want to do and participate in society, which is what we all want as occupational therapy practitioners. So, how do you choose the path that's right for you? So, here are some things you might want to consider. If you value stability and structure, the employee health coach route might be perfect for you. You get immediate income, remote work flexibility, and the chance to practice coaching skills without having to do the business development pressure. If you're feeling entrepreneurial and you want to maximize your autonomy and income potential, building your own practice could be ideal. This path requires more risk tolerance and business skills, but often offers unlimited growth potential. If you love your current OT work and don't want to leave, but you do want to enhance your effectiveness and possibly create new opportunities, integrating coaching skills into your current practice might make the most sense. And here's the beautiful thing. These paths aren't mutually exclusive. Many successful OT health coaches have combined these approaches. You might start by integrating coaching skills into your current practice and then take on some part-time coaching work to build your experience, and then eventually transition to your own practice. The great thing about this is that it's an opportunity to build a career that works for you. So many times as OTs, we are stuck into the system and we're told what hours we need to work, what patients we need to see, and often like the evaluations and interventions that we need to do to be consistent with our OT colleagues. So health coaching provides different opportunities to build a career that works for you and your family and helps you create a career that you could feel good in now and into the future. That's all for this episode of the Health Coach OT. Thank you for joining me today. If you're ready to expand your OT practice with evidence-based coaching skills, subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts and leave us a review. It helps other therapists find the show. Ready for the next steps? Visit healthcoachot.com to join our newsletter for weekly evidence-based coaching tips and get early access for our certification programs and courses. Keep expanding on what's possible in your practice, and I'll see you next week.